Good day everyone. Welcome to the NGP School's Expert Talk series, where we bring you inspiring talks with the professionals who share their profound knowledge and invaluable information to the world through our YouTube channel. Hey, I know the reason for your wide smile. Well, today we are glad to celebrate World Oral Health Day, a global invite to emphasize on the importance on good oral hygiene and its impact on overall health. Say cheese!
World Oral Health Day encourages everyone to take pride in their oral health and also encourages them to keep smiling. To help us understand more about maintaining our dental health, we are honored to have Dr. Captain Ramani Kumar, a renowned dentist serving KMCH for the past 2 decades.
We consider it a great honor to introduce the expert professional for the day, Dr. Captain Ramani Kumar Vedanayagam. Graduated from Madras Dental College, Chennai in 1980. Following her graduation, she served as a captain in Army Dental Corps for 10 years before joining KMCH in 1992. Dr. Captain Ramani Kumar is now the senior dental consultant in Covey Medical Center and Hospital.
Wondering why we address Madam as Doctor first and then as Captain? Let me brief you. Dr. Captain Ramani Kumar served the Indian Army Dental Corps for 10 years as it was Madam's dream to adorn the olive green uniform right from her childhood. During this period, Madam had the honor to lead the medical troops in various strategic operations, and one of them is Operation Blue Star. Madam also had the opportunity to command the dental department independently. As there was no permanent commission for lady officers, Madam had to quit the army after 10 years of service. Thereafter, Madam was fortunate for having been connected with our Honorable Chairman Sir Dr. Nalaji Palniswamy and thereafter started the dental department in KMCH 30 years back. With years of experience and expertise, Dr. Ramani will share her valuable insights about oral health and also guide us on how to maintain a healthy smile. Welcome, ma'am.
Thank you so much, Vikas and Hasini. That was a long introduction, and I'm so happy. I'm delighted that the team NGP School has taken it up as one of their projects to participate in this campaign, which is Good Oral Health and Oral Health Day. And the motto for the last year's Oral Health Day, do you know what it was? It was Happy Mouth, Happy Body. And this year it is Happy Mouth, Happy Mind. We will talk. I will welcome you to ask me whatever you want to ask about oral health, and then I will add my additions to it, whatever I can do that. Sure. Thank you so much.
Shall we begin our interaction?
Sure.
Ma'am, why is it important to celebrate World Oral Health Day?
Okay. So, according to me, every day should be an oral health day. But when we make a platform and choose a specific day, then we are able to have people concentrate on that day. And the aim of this campaign is to make people aware that oral health is not just for the mouth. It also, oral health, bad oral health or good oral health can impact the general health and general well-being. Now, a lot of people may not know the meaning of the word oral. What does oral constitute? Oral health constitutes, oral includes the mouth, the teeth, the organs inside the mouth, that is the tongue, the soft tissue, the bones. So all this put together compromises of the health of these structures is what is called as oral health. Okay, so the basic aim is of campaigning is that everybody concentrates and does what needs to be done to make people aware of. And again, I'm very happy that you people have taken it up as a project, and I'm sure it will reach out to a lot of people. Yeah.
That's a great perspective, doctor. Now that we understand its importance, let's talk about daily habits. Brushing twice a day is a recommended practice, though not sure how many of us actually practice it. So, apart from this, doctor, what else do you think we should do to maintain a good oral hygiene?
I always tell my patients or the people I come across that you brush in the morning to feel fresh, and you brush at night so that you don't need to visit the dentist. Because if you brush at night, your teeth are going to be happier. The whole day you eat stuff which gets, even if you rinse your mouth, it gets stuck in your, so brushing twice a day. Apart from brushing, rinsing your mouth, which was an age old practice. You will see your grandparents, your parents, after a meal, they would rinse their mouth and spit out. But nowadays, you are busy, you run around, you eat your sandwich while driving, you do that, so you forget to rinse your mouth. So rinsing your mouth is as important as brushing. Rinsing your mouth after anything you eat or even you drink, like if you drink milk or you drink coffee or something, it's a good idea to rinse your mouth. Then there is another aid which is available, which not many people know about. That is a dental floss. So dental floss is a small thread, wax thread, which you pass between your teeth to cleanse your teeth. Now, why is it flossing is important? Because when you chew food, not just sweets or any food, it becomes very soft and it can reach between your teeth. So the brush, like how you try to clean a comb, if you clean a comb this way, it's not going to remove what is between the. So similarly, for even after brushing, the brush bristles don't reach between the teeth. So that is when you use this thread floss to floss your teeth. So flossing should become a habit, and a lot of my patients keep having this doubt that if we pass something between the teeth, will that increase the gap between the teeth? No, the teeth are quite firmly fixed into your bone, so it will not. It will cleanse between the teeth. So flossing is another important major cleansing aid that should be used apart from brushing your teeth. Then the third thing apart from cleaning is that you should understand that it's not just the sugary food particles which are harmful to the teeth. Any soft foods can get deposited on your teeth and cause dental decay, dental caries. And what is dental caries? It is nothing but the food particles which get stuck on your teeth along with the bacteria which are already present in your mouth start producing an acid which starts disintegrating the hardest layer of the tooth, which is the topmost layer. Which is the topmost layer of the tooth? The enamel. Yes, the enamel. So once the enamel starts getting disintegrated, that is what is called caries, or in Tamil you say sottepallu. So it's not really a pulu or a puchi, it's just that what is left. So what can we do? We can make sure that these soft particles do not get deposited on your teeth by good brushing and rinsing your mouth and flossing your teeth. So those are the three things you have to be careful. Flossing, rinsing your mouth and brushing your teeth at night especially. Okay?
Thank you for those tips, ma'am. Sometimes, despite good habits, dental issues arise. Could you tell us about some dental issues that children, say 5 to 10 years, face, and other orthodontic issues we teenagers face? How could these be prevented, ma'am?
Okay, so the teeth start erupting in a child's mouth in an infant from the age of say 6 to 7 months, and by the age of 2 years they have a complete set of milk teeth. Why are they called milk teeth? Because they are going to shed later, and children are mostly on a milk diet and they are whiter than the other teeth, so they are called as milk teeth. So now you have 20 milk teeth in the mouth, and from the age of 2 years the complete milk teeth dentition is completed. Then from the age of 5 years the milk teeth start shedding and new teeth, the new permanent teeth start coming into the mouth. This happens from the age of 5 years till 12 years. So from 5 years to 12 years you will have mixed dentition. There will be some loose teeth, there will be some teeth which are going to fall, and there will be some new teeth. So what happens is, despite of good brushing, sometimes when there are a lot of loose teeth in the mouth, when the child tries to brush, it would hurt. So the brush doesn't reach all the spaces, and then in the bargain, sometimes even the new milk teeth, despite the fact that you are brushing, but you are not able to brush well because there are these loose teeth which are hurting, so they tend to develop caries. So always, most times the milk teeth, when they become loose, they will fall by themselves. But nowadays some children are very precautious. They will not bite, they will not have fruits, or they will be eating only soft foods. So what happens is the teeth don't fall. So then it is advisable not to let the loose teeth remain in the child's mouth for a very long time, so that they can brush well and have them removed. It's a simple procedure. We just spray and the tooth is right on top and we remove it. So you are saying that despite of brushing, this can be one of the reasons. Then for teenagers, what happens is sometimes the size proportion of the milk teeth and the permanent teeth and the jaw size is not not adaptable to each other. So you tend to have crowding. You will have, there's less space, less jaw space, and the size of the teeth is bigger. So what happens is the teeth start getting crowded. When the teeth get crowded, then your brush doesn't reach there. So that is one more reason why a decay can happen. And it is very important to know that there are almost 3.5 billion people suffering from dental caries, which is a very preventable disease of the mouth, of the teeth, important, because streptococcus, which these bacteria can land and give trouble in the heart, can lead to bad gums, can lead to different gut problems, all those issues. So that is the reason why teenage children and smaller children can have discomfort. Basically it is more brushing required, but despite of brushing you can have this.
The market is flooded with ads on toothpaste and toothbrushes. Toothpaste with salt, toothpaste with charcoal, toothpaste for sensitive teeth, etc. and etc. Now, what actually do you recommend, doctor? How do we pick on our requirements?
Okay, so I feel the marketing strategies for toothpaste with salt and charcoal goes back to the days when there were no toothpaste available. Okay, so people used to use ash, they used to use sticks like a neem stick or a kikar stick, and they used to use even fine charcoal, because these were the only abrasives available to clean your teeth. So now with the advanced technology of making toothpaste, basically you should know that the toothpaste consists of 3 or 4 basic ingredients. One of them is abrasive, and which will help cleanse your teeth. Second one is a foaming agent. So the foaming agent is required because, as I told you, there are crevices between the teeth and between two teeth, or between the last tooth and the upper teeth and all that. So the foaming agent helps the toothpaste to reach different portions. Then there is a certain amount of fluoride added nowadays to the toothpaste, because fluoride is a salt which helps coating the enamel of the teeth with this fluoride, which is an anti-caries, which has an anti-caries property. So I normally say that toothbrush is more important than the toothpaste. It's the way you brush your teeth. One should never use a soft brush. There are 3 kinds of brushes available. One is called sensitive or soft, the other one is called medium or regular, and the third one is called hard. So for most people, except debilitating or old people or with some issues with their mouth, other than that, everybody should be using a regular or a medium toothbrush. Very important to see on top of the toothbrush, it would be written medium, soft and hard. Now regarding the toothpaste, for caries is inversely proportional to the gum disease. We'll come to the gum disease a little later. So what happens, caries most times happens in young adults and teenagers. So it would be helpful to use a toothpaste which has fluoride in it, right? And for the older people, they tend to develop more gum disease. So the toothpaste which advertise saying they have salt or they have some herbs or something, those will be good for older people because they have astringents in them which help the gums to stay taut. So, but by and large, if you use the brush and the toothpaste twice a day the right way, then any toothpaste is good. There are some medicated toothpaste available for sensitive teeth which have an additional medicinal property which helps in decreasing the sensitivity, which happens because of some gum issues or because of caries or because of swelling in the gums or because of acidic saliva, the enamel gets worn out. That is one more reason why sensitivity can happen. So for those kind of things, medicated toothpaste can be used. Otherwise, one and all is good.
That's really great to know from a dentist. Am I right, audience? Moving on to the next question, doctor.
Using correction braces these days have become common, ma'am. Are they really necessary? Why are they becoming increasingly common in teenagers and younger children?
Okay, apart from requiring braces, we have also seen, we didn't touch that, out of the 32 teeth, there are four teeth which are called wisdom teeth. Why they are called wisdom teeth? Because after all the dentition is completed at the age of 12 years, these teeth start erupting after the age of 14 or 16 or something like that. So what is happening now, because of the advanced food habits, eating softer foods, the jaw sizes are becoming smaller. So these wisdom teeth are becoming redundant. Similarly, the teenagers, why they have started begin to need braces is because I earlier also said that the jaw size to the size of the teeth is not proportionate. I am not sure whether the problem is more now. It's just that the corrective devices are available now. So we are more aware about it. And what happens when you have, why you need braces? One is if most times if the teeth are proclined, that could be because of some habits like thumb sucking or pencil chewing or some speech ways of speaking. The other thing can also be disparity in the sizes. Now, why should the crowding be corrected apart from aesthetic? Aesthetic is just one part of correction. It is because the crowded teeth you will not be able to reach the brush at the teeth which are overlapping each other. So you would tend to get caries teeth, and then sometimes if the back teeth are not in proper contact with each other, they are forward or backward or something, then it will lead to inefficient chewing of the food. So basic function of the teeth is chewing and helping you grind your. So most times it is, if the dentist advises that we need to do an orthodontic treatment, it needs to be done. And also I have seen most parents being very apprehensive when sometimes we need to advise to remove 4 permanent teeth in order to accommodate to straighten out the teeth. So which is not, it's not a problem. It is one of the treatment modalities to be able to arrange the teeth in a compact way in which they can be cleansed properly and they can function properly. So that is what is required. That's why you need to have braces. So.
That's reassuring, doctor. Now let's talk about maxillofacial surgeries. Doctor, you would have come across treating patients who met with accidents to fix the injuries of their face, mouth, jaw, or neck. Can you tell us the role of a maxillofacial surgeon in treating major or minor accidents?
Okay, so one of the very important aspects of maxillofacial surgeon is also to make people aware of safe driving. They have to be, most of these accidents are two-wheeler accidents. A lot of them are teenagers not wearing helmets. Okay, so now when the accident happens, then it's most times it's the lower jaw if it's a small, because the impact is on the chin and the jaw breaks, or it can be even the face, all the face bones. So earlier what was the treatment for it was, we had to, just like if any bone fractures, you need to immobilize. For it to stay, for it to join together, you have to make sure that it is immobilized. Now how do you immobilize the mouth? It's tricky because your mouth is always moving. You need it for talking, you need it for chewing. So earlier the treatment was that there were wires passed between upper and lower teeth, and you fix the jaw. So for 6 to 8 weeks, all you have to do is, you can only take liquid food. Talking is possible, but it would hinder in the daily activities of a person. But now the latest, not latest, it's been for some time, but it is one of the very advantageous inventions, is that they put plates. There are these steel plates. If there is a fracture line here, the jaw is opened and the steel plates are fixed, so that that portion of the bone gets immobilized. And at the same time, we tell the patient not to eat anything hard, but they can function normally for 6 to 8 weeks. So that is one of the. Then of course, maxillofacial surgeons and the periodontists, that the doctor who treats the gums, they have now implants are to replace the teeth. Implants are coming up in a big way. Earlier, if the tooth falls or if you lose a tooth, it had to be replaced only by wearing removable dentures. You would have seen your grandparents keeping their dentures at night in water. So now the dentures are also something that you can wear 24 hours. Also, they are fixed with the implants which are into the bone, so that you don't have to remove them. So that is one of the very, very useful inventions in the present dentistry.
Thank you, ma'am. It was an informative one. Doctor, could you tell us about the technology's interventions in this field of dentistry?
Okay, so starting from when I joined the army, we never had very high speed instruments. Enamel is one of the hardest substances. When you want to uh, restore a tooth, if you have a decay, then the procedure is that the decay should be removed. All those microorganisms and the diseased enamel and the next layer dentine has to be cleaned. So we used to use only these tips which were made of stainless steel. But now we are using diamond tips, which are very smooth in cutting the enamel. Then the filling materials, when I was in college, actually gold foils were used to fill, because that was the only material which was bio-friendly, which could be used. So you could fill the teeth either with that or with silver. But the silver had to be mixed with mercury to make it malleable. So mercury was later on, the discard, the remaining portion of the mercury which is discard is injurious to health. So now we have materials which are totally, they have glass particles, they have silica in it, and they are equally strong, and they are tooth colored. And so this is a real boon, because we don't have to use metal, we don't have to use mercury, and we can use these materials and they set immediately. So we don't tell you that after doing a filling, don't eat for half an hour, don't do this. So these are one of. Then sometimes there is excess fluoride in the water, so that can cause staining, internal staining of the teeth. So which in certain areas you will see a lot of public having discolored teeth. So for that we have now laminates. It is like you stick a laminate on the wall. Similarly, you abrade the tooth a small bit and you can put laminates on them. So laminates, light cure filling material, plates and screws for surgery, implants, these are all very helpful, and these are the more latest inventions that have helped in the treatment of dental caries. So,
That's inspiring and it indicates progression in the field.
yes, yeah, there's a lot.
Thank you, ma'am, for such an exciting interview. Your answers not just taught us how to take better care of our oral health, but also the exciting possibilities in the field of dentistry.
We are truly grateful for your time and for sharing your expertise with us. Your words will inspire many of us to think more seriously about oral health and perhaps even consider it as a future career.
On behalf of the NGP school, we thank you once again, ma'am. Let's all pledge to be proud of our mouths and spread the message of good oral hygiene.
Thank you.
Thank you all for being a wonderful audience. Like, share, subscribe, and keep smiling.